The CIRCULATE study is a study looking at early stage colon cancer, trying to ask a very simple question. Can we use ctDNA to determine whether or not patients should get chemotherapy, or whether patients who are ctDNA positive should get escalation of chemotherapy? So the way CIRCULATE-North America, or NRG, GI008, is designed is to take patients with high-risk stage 2 or any stage 3 resected colon cancer, and those patients are then going to get ctDNA testing. This is a tumor-informed assay, and it's to be obtained after surgery for early stage colon cancer. If patients are ctDNA negative, they are randomized in a 1-to-1 fashion to receive standard of care chemotherapy, which is investigator's choice, or surveillance with the typical CEA and CT scans, but also ctDNA surveillance as well. If patients are ctDNA positive, then they're randomized to receive either standard of care chemotherapy or triplet chemotherapy with FOLFIRINOX. If patients are ctDNA negative and eventually become ctDNA positive, then they can be randomized into the second cohort and get either standard of care chemotherapy or triplet chemotherapy. And again, the main primary endpoint of the study is disease-free survival, looking at both groups, both patients that are ctDNA negative and patients that are ctDNA positive. So ctDNA is an emerging technology. What we know is that patients that are persistently ctDNA positive have an incredibly high rate of colon cancer recurrence. We also know that patients that are persistently ctDNA negative have very, very low rates of recurrence. So we know that this is an incredibly prognostic test. What we don't know is if this test can predict the benefit or lack of benefit of chemotherapy. In other words, are patients that are persistently ctDNA negative, will they benefit from chemotherapy? And I think that that's a question that CIRCULATE-North America is really trying to answer. Conversely, if patients are ctDNA positive and are persistently ctDNA positive, is there a way to escalate chemotherapy? In other words, giving FOLFIRINOX versus FOLFOX or CAPOX, can that improve outcomes in terms of improving disease-free survival? These are all questions that we don't know, and I think that that's why these randomized clinical trials like CIRCULATE-North America and our GI008 are so important. So I think the big thing is just to accrue to it. This is a very, very large study. We're going to plan to enroll somewhere between 1,700 and 1,900 patients. So we need a lot of sites involved. We need patients excited about the study. And again, the importance of the study is we're never going to truly know how best to use these ctDNA assays until the randomized clinical trials are done. And so I certainly encourage everybody to strongly consider this study if they have a patient with high-risk stage 2 or any stage 3 colon cancer.